Hello, Chairwoman. Thank you. And hello, Commissioner. For the sake of time, my first question is really a yes or no answer, and then so I can get on to the rest. But during your nomination hearing, I asked whether you would support a review of New York's pandemic response, and you said that you decided not to unravel what happened with the past administration. Just wondering if you reconsidered that, or is it still your position today?
It's still critically important to me to make sure that residents of nursing homes remain safe during Omicron, and we've been doing that at the health department.
Oh, okay, that's not the answer I was looking for, because we really need to look backwards to find out what went wrong. So I think that's unacceptable, respectfully. And as you know, we have legislation that would actually require the Department of Health to do just that and to release a public report on your findings and conduct a re-audit of the number of COVID nursing home deaths. And we requested the governor include this language in her 30-day budget amendments. So just wondering what financial resources would the DOH need to accomplish this, if you could answer that.
If this is pending legislation, obviously I won't comment on that. If it's passed, of course, we'll read it. And
okay. Thank you. And then what's being done for the assisted living care facilities in this budget too?
Oh gosh, there's so much. We have both funding for health workers and for capital support. Is this something you can?
I can help too. Yeah. The across the boards are also going to impact the assisted living providers because they are a recipient of Medicaid funding. To what Dr. Bassett mentioned, their workforce will be eligible for the worker bonuses. And we're also considering ways to assist assisted living providers using enhanced federal match from Section 9817 of the American Rescue Plan Act to help fund things that aren't covered in the rate, things like capital and other investments that they've had to make during COVID. Those are under active considerations, but assisted living is very important to us in the Medicaid program and the department, and we look forward to supporting them.
Okay, yep. And for the sake of time too, I hope that you consider also, people have been talking about the masks, and if you have had conversations with anybody about the mental health that's affecting our children, speech pathologist, and we can always follow up with that too. And I also I would suggest, Commissioner, if you could possibly meet with the families, if you could set aside some time in the coming weeks to meet with them who lost their loved ones to COVID in our nursing homes, so that you can really hear firsthand about their experiences. And maybe then you'll understand why we're so committed to continuing down this path. And also, if you, Lyme and tick-borne disease is not in the budget. I haven't heard anything. And you know what? That's really a major public health failure. So I would hope that that would be something that you would look into as well. And I look forward to sending you some more questions that you could follow up on. Thank you.